Deficiency of which vitamin is most likely explain the presentation of a 3-year-old child with rickets. That means which of the vitamin is responsible for the rickets in case of children. Here the options are vitamin C, vitamin B3, vitamin D, vitamin A, vitamin E. So now see some of the vitamin and their deficiency disorder. First of all, vitamin A. Vitamin A, it is responsible for night blindness. That means vitamin A, it acts on the rhodopsin of the retina, also the epithelial atrophy and infection. So in case of reduced vitamin A, they also develop epithelial atrophy, that means the tourist skin, also the infection. Vitamin B1, it causes beriberi. Vitamin B2, it causes dermatitis and photosensitivity. On the other hand, vitamin B3, it is responsible for pellagra. So vitamin A, night blindness, epithelial atrophy, infection. Vitamin B1, beriberi. Vitamin B2, dermatitis and photosensitivity. Vitamin B3, pellagra. Vitamin B12, which is one of the important vitamin, and it is deficiency causes the pernicious anemia. So when there is deficiency of the vitamin B12, it causes pernicious anemia. Vitamin C, it causes poor wound healing and impaired collagen synthesis. On the other hand, the vitamin D, it is responsible for rickets and osteomalacia in adult. So in children it causes rickets, and in case of the adult it causes osteomalacia. So osteomalacia and rickets, they are occurs due to deficiency of the vitamin D, and vitamin K, it is responsible for the clotting disorder. Now see, the vitamin D is needed to help the mineralize to the bones. So for mineralization of the bones, vitamin D is very, very essential. When this is deficient, mineralization is inadequate and deformities may result. So when there is vitamin D, then the mineralization is not possible and different type of deformity occurs. So here we can see the growing bone. First of all, in the reserve, then proliferative zone of maturation, zone of degeneration, and zone of provisional calcification. So when there is the deficiency of the vitamin D, so calcium cannot be absorbed. So zone of provisional calcification, it is not formed well. In this area also, here we can see the different changes occurs during the bone formation. And again here we can see this is the ossification zone, hypertrophic zone, hypermitotic zone, proliferative zone, and resting zone. And vitamin D plays important role in this stage for the calcium deposition. So when there is deficiency of vitamin D, sufficient amount of calcium is not deposited. So what is cause of the rickets? The cause of the rickets is the vitamin D in case of children, but in case of adult it causes osteomalacia. Vitamin C is responsible for poor wound healing and poor collagen synthesis. Vitamin B3, it causes pellagra. Vitamin A, night blindness, tourist skin, and repeated infection. And vitamin E, it is not responsible for rickets.